This presentation is the management of a patient with postural orthostatic tachycardia syndrome, a new perspective for the physical therapist. A case report. Postural orthostatic tachycardia syndrome, or POTS, is an autonomic dysfunction that's characterized by headaches, fatigue, dizziness, palpitations, sweating, nausea, and syncope. And the physical therapy management of POTS is not well established. Therefore, the purpose of this study is to present a case on a patient with POTS who underwent a multimodal exercise intervention while in physical therapy. The patient was a 25-year-old female diagnosed with POTS, and she was experiencing symptoms associated with the condition. She was not undergoing any pharmacology for the management of her symptoms.
This patient underwent 30 sessions, approximately 60 minutes, each session over 12 weeks. This multimodal approach to treating looked at aerobic training, functional training, and strength training. And the outcomes that we looked at were the SF-36 and the average patient subjective history reports. SF-36, where we'd like to focus on, were physical functioning, energy and fatigue and pain, which improved at the end of visit 30 to about 12.5% for physical functioning, 20% improvement for energy and fatigue, and 27.5% improvement for pain. The patient's average subjective reports for goals looked at the 66 and about 60.5% at the end of visit 13. At the end of visit 22, there was an improvement to about 34.4%. And at the end of visit 30, there was an improvement of subjective history reports by about approximately 30%.
Overall, the authors concluded that the improvement in the patient's subjective reports and on the SF-36 can be supported by previous research stating the improvements with parasympathetic tone. Parasympathetic tone improvement may also be due to the aerobic training components. There were a few limitations, including the small sample size, our inability to determine which modes of exercise correlated to the greatest improvements. And the clinical significance is that the authors, based on the author's conclusion, the incorporation of aerobic, functional, and strength training into the treatment of a patient with POTS may result in positive effects on the parasympathetic nervous system, which would improve subjective reports of lightheadedness, dizziness, chest palpitations, and/or quality of life.